One of the key aspects, we are all, as a cell therapist, as a hematologic malignancy doctors, we're very excited about the promise and the effectiveness of a cell therapy for our patients, which are now commercially approved for leukemic patients, lymphoma patients, and multiple myeloma patients. But we also do aware that, despite this, the high effectiveness, and sometimes we're actually able to cure these patients with the one single cell infusion, we're seeing less patients that we probably are able to see or could see, or the patients eligible for this type of a therapy. So we wanted to better understand what are some of the key barriers in receiving CAR T cell therapy for different disease subtypes. So we looked at multiple myeloma, lymphoma patients who were referred to our institution at Sloan Kettering for consideration with CAR T cell therapy, and how many of these patients actually received the CAR T. And for those who did not, what were the primary reasons in not receiving them, so that we can better identify the reasons and hopefully the future actions to mitigate or to expand the promising cell therapy to those patients who need them. So what we have found is surprisingly that about 40% of the patients did end up not receiving CAR T cell therapy in this lymphoma and myeloma cohorts, which is larger than expected. So about 20% of the patients were due to the reasons that, and that they are not available CAR T cell therapy, mainly due to they didn't have any disease at the time of referral, which is actually a good thing. They're in complete remission and they may not need to have a CAR T cell therapy at the moment, although in the future that might change as we're investigating CAR T cell therapy as a consolidation in these CR or in the MRD negative CR patients. So that was 20% of the patients. The other 20% of the patients, actually the opposite reasons. They had a too aggressive disease, too prolific disease to allow us to have a collection of the T cells and manufacturing the receipt of the CAR T. And these autologous CAR T cell therapy, as effective as they are, does require several steps. And so not everybody may be eligible for them. And those patients who have a very high burden disease or rapidly proliferative disease need a more immediate disease control, making it very tricky to allow in scheduling for CAR T cell collection and manufacturing. So about 20% of the patients are related to that. And that was eye-opening, and which we knew from the clinical trial that we need to do a better job of getting these patients early and getting the disease control. The other 20% were actually due to more logistical barriers. Currently, CAR T cell therapy, due to some of the REMS, the criteria, they do need to stay close to the treatment center for the first 3 to 4 weeks of a treatment, which can disrupt their normal schedules, require caretakers and time off from their work and so forth. So which may not be conducive for a lot of our patients to travel to these treatment centers to make that, no matter how effective they might be. So those are the areas that we have realized and seen before, but it was kind of, good to see the actual numbers of what these are. So now based on this data, now with a better understanding, we're trying to address each of these areas of too early referrals or trying to develop clinical trials to address those patients, and too late referrals that we want to see these patients early rather than later. We rather see them patients when they may not need a CAR T cell therapy, so we know them. So it'll be a lot easier to see them later on, and we can better advise kind of what to do in the meantime. And then certainly for the logistical barriers, that we're trying to provide more support for our patients to make things easier for them to receive it. And we're working, and with the regulation is getting less and less in terms of the therapies getting safer and safer, that we're hoping to lessen the duration of the stay. They need to be close to the treatment center, which will make things easier for our patients receiving CAR T cell therapy.